Welcome to daily coverage on iTube OD from Vision Expo West in Las Vegas. We're joined today by a local in Las Vegas, Dr. Doug Devries. Doug, you did some innovative talks on new therapies in and around dry eye, or even new diagnostic tests. Can you tell us a little bit about that?
Well, we had a class on the very first day, and it's a great class. It's with Mark Dunbar, Kirk Smith, Peter Shaw McMinn. It really is to introduce attendees to technology that is new, that is coming out, that maybe has just been launched, and that was on Wednesday afternoon. And what I covered in that is I covered a couple different areas. One I covered was the Bluff X instrument.
Explain what that is.
Well, the Bluff X is an instrument that actually does a micro blepharoexfoliation. So in other words, it takes the biofilm off of the lids. It frees up the meibomian glands. It affects the food source, the polysaccharides that grow on the lids for Demodex. So it's really a very positive treatment for both posterior and anterior blepharitis, and it's something that I've been using now for probably the last 6 months, and had tremendous results. So I wanted to share that with optometrists. As we polled the audience, nobody was using the technology. So it's just part of the advanced dry eye treatment that is offered now.
So do you view something like that as preventative, or is it a treatment?
That's a great question, and I think it really is both. It is absolutely a treatment, but when you consider doing something proactive to try to keep the lids from getting the way they are, it's a great treatment. I really look at it like the dental cleaning of the lids.
Now, is there anything as far as diagnostic-wise, maybe picking up certain aspects of dry eye that is new, or something that maybe is just coming to healthcare?
Well, something that really is emerging at this point, and it has been absolutely revolutionary, and that has been the new show test, or the ability to do a lab test to detect Sjogrens syndrome. One of the problems with the detection of Sjogrens syndromes is estimated that there are about 4 million Sjogrens patients, of which 1 million are diagnosed, simply because patients don't respond to the conventional markers that are used in the lab testing, the row and the law.
But, conventionally we all think of a Sjogrens patient as just, the frail, dry female patient that looks sickly. Is this in your experience the people that have Sjogrens?
No. I mean, and the reason for that is that we get those patients now from rheumatologists who are really end stage. They have advanced autoimmune problems. They have Sjogrens. They're being sent off to eyecare to take care of their problem. And that is the typical portrait. What really emerges as we can detect sooner is that it may be the 30, the 40-year-old patient that is starting to develop the lymphocytic infiltration of the lacrimal glands and salivary glands that could then lead to. So now, instead of getting them from the rheumatologist, we're discovering them, and we're sending them to rheumatology before they ever have any systemic autoimmune problems. So it really is a whole paradigm shift, which takes education of rheumatologists as well as the eye care providers. Well, that's what we were doing, is really providing that eye care provider education to say, hey folks, you can do this in your office. It's really just a finger stick, 6 drops of blood, send it off to the lab. The lab handles all the billing. Or now you can actually send to, with the specific lab slips, LabCorp will actually run the early Sjogrens detection, which is, where you used to have a specificity and sensitivity of 50%. Now we're talking 90% and above with the new test. So,
all right, thanks, Doug. That's great. Thank you for joining us today on iTube OD from Vision Expo West in Las Vegas.